is there is an absolute policy of annihilating the healthcare system and the ability for people to be to heal themselves in Gaza. And it's from every possible facet. The actual structural infrastructure is being bombed, raided, destroyed from the inside by Israeli soldiers as they're sieging these hospitals. We've seen it take place at Al Ahli Hospital. We saw what happened to Shifa. We saw it at European Gaza Hospital, just to name a few of the 36 hospitals that we talk about. We also saw the detonation of the Turkish Friendship Hospital, the only cancer hospital in Gaza. Yeah, you can get cancer care at some of these other hospitals, but the Turkish hospital, Friendship Hospital, which had made strides in chemotherapy and cancer care, they literally charged it with and detonated the entire building. It was a demolition. And that why that happened, we never got an explanation for that to this point. The other thing that you're seeing is the killing, the abduction, and the sort of harassment of Palestinian healthcare workers. We know more than 1,000 healthcare workers have been killed. Almost every northern director of a hospital has either been killed or abducted. Marwan al-Sultan, one of two cardiologists in the north of Gaza, killed. Muhammad Abu Salmiya, the director of Shifa, was abducted and subsequently released. And Dr. Hussam Abu Safiya, director of Kamal Adwan, the only pediatric hospital in the north, abducted without charge, still in Israeli dungeons. And then we talk about how these healthcare workers specifically are not being paid, but also being starved just like the rest of the population. And they're being deprived of the materials that they need because those trucks are sitting outside of the border and are being blocked by the Israelis, whether that's because of a dual use list or because there's a suffocating siege, or there are settlers that are interrupting their delivery. So sterile gloves, scalpels, band-aids, alcohol, antibiotics, anesthetics, all of these things are in critical shortage all throughout Gaza. Some of them are at zero stock. And so you're hampering the ability of healthcare workers to be able to do their job. They're starving in the process. Some of them are injured in airstrikes or killed. And we're not even talking about the moral injury that you're going to endure 22 months of seeing your local community sort of be annihilated in the way that it has.